If you want to go the US after your BDS in India, you have to give the iNBDE exam. This everyone is aware of. But once you do that, how do you improve your resume? How do you apply to the various universities? Those questions keep on nagging us. And to help us answer the important question of how to improve your resume after your iMBDE exam, we have with us Dr. Navreet Sidhu. Dr. Navreet Sidhu graduated at the top of her class from HGRD Dental College, Amritsar, after which she got into the prestigious International Dental Student Program at UCLA School of Dentistry. She then did her general practice residency from Brooklyn Health Program. She then followed her passion and applied and got accepted in the very competitive pediatric dentistry residency program in Mount Sinai, Manhattan, New York. She also served there as the chief resident, and today she is among us to help understand how do you improve your resume after your iNBDE exam. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Navreet. It's amazing that you're thinking of the future of dentists who are coming to US from abroad, and you have planned to come up with a bench test and teach them how to go about getting into DDS and masters. Thank you for doing that. But let's get to the crux of the topic. After giving INBD, the focus is always on improving your resume. What do you think are the various methods one can do to improve one's resume?
Yes, absolutely. Thank you so much for having me. I cannot tell you how excited I am to tell all the students out there about the wonderful program that we've been working very hard to launch. So, starting with your question, the getting accepted into international dental schools or in the US is starting to get more difficult. We already know the INDB examination is not pass and fail. When we talk about a resume, I really want students to think of their resume as like their personality, but on a piece of paper. Um, Working on different aspects of the resume includes, improving your professional experience in India or abroad. If you're a specialist, trying to take CE courses, continuing education courses in India, or finding a niche or a specialty that interests you if you're a general dentist and continuing to work towards that. I hear this a lot. There's a lot of misconception that I'm taking all these, courses in India. I am a practicing dentist in a different country. Will that even matter? Like, does a dental school in the US like really care like what I'm doing in a different country? What really matters is what number of breaks you have in your resume. So consistently working towards, improving your skills as a dentist and improving yourself as a professional is very important. And the other aspect to focus on, say you are very interested in, academia, associating yourself with the dental school is a really good idea, be it in the, in whatever country you're involved in. It's important to get into, it gets you into the, a research mindset. You're able to present different cases, write a case report, a case study. That's another aspect. And the third aspect, which we always miss, is the extracurricular. Having something really interesting and exciting in your resume. It could be, for example, like you are really particular or you're very interested in nutrition. I've seen or met with students that have taken courses or even done a master's in nutrition because again, dentistry is very closely related to what we eat. So improving an extracurricular aspect of your resume is just as important. It could be, you're a chef or you're a runner, you're an athlete, trying to like include aspects of, something besides academic is also very important. So I would say focusing on these three elements, starting with, your professional experience. Second, any academic experience that you can get from like poster presentations or, publishing a paper. It could be a case report, an interesting thing that you came across while you were teaching or in a teaching faculty position at a dental school. And thirdly, the extracurricular aspect. So these are some of the aspects that you can work on when we talk about improving your resume.
Great. These are tips which people usually do not talk about. For example, the extracurricular part and everything. It's great that you're coming up with in-depth tips which would help them. But one thing I've heard which helps students when they are trying to improve their resume is something known as shadowing, which is basically going to others' clinic and observing, what we call it in India. So, how does shadowing prepare one for getting into admissions into dental universities out there?
Absolutely. The way that I mean, it's interesting. The concept of clinical observerships is really embedded in the mindset of student, like say medical students that come to the US and take USMLEs. Everybody knows we need to do a clinical observership because their programs are very structured. As a student, as somebody that applied to international dental, schools myself, I struggled to find a dental practice that could guide me. So, how an observership program helps you get into dental school is, first of all, it's like a window into how dentistry is practiced in the US, which is honestly very different to how it is practiced in India. And I'm talking from the standpoint of, say, electronic medical records, how a history is taken from when the first time the patient sits in your chair, the different elements of how we greet or meet a patient and how we come up with a wholesome preventative plan. The crux of, say, a dental examination in the US, first of all, is preventative. We are trying to keep the patient with us long term, trying to care for them from a wholesome perspective, not just a problem that they came into the office with. So it's, I would say, it's like a window into how you practice dentistry in the US. You can get some solid talking points for when you're invited to an interview, something interesting that you saw at the dental practice that you shadowed. So observing and spending time trying to find the right kind of mentorship with dentists in the US is very important. What I've seen is there's a lot of practices that you can collaborate with dentists and just follow them. But it's very important to look for observership, preceptorship programs per se in a private practice that have a structured program that don't just focus on, say, clinical aspects of dentistry, but also teach you certain didactic like skills. How do we protect patients' health information, HIPAA compliance? How do we make sure that there's health standards being followed in a dental practice? So many elements to it, which are important when we look for an observership. So they become talking points. There's mentorship opportunities. Plus, when you are finally sitting for a dental interview, there's so much that you can talk about. So that's how an observership program really builds your confidence, especially when you sit in front of faculty that'll eventually interview you while you're sitting in for a dental school interview.
Great. This is something which I've heard time and again. Practices in India are absolutely different from practices in the US. It's basically not the treatment part, but the entire way how the system is run. And people in the universities out there want to know that you have an understanding of the US system. You're actually interested in the US system. You've put in that extra effort to make that shift from being an outsider to an insider. So in all these ways, shadowing truly helps, and I've seen it make a lot of difference in a dentist's resume if they have done shadowing or not. So yes, I totally agree. Shadowing is a must, and it helps improve your resume and your confidence about the system as well. But for
Absolutely.
those who are unfamiliar, could you explain? You use the words, we have used the words like bench test, interview.
Right.
Could you explain what is it? Why is it essential for international students who are aspiring to get into masters or DDS there?
Sure, absolutely. So what a bench test essentially means, there's two aspects to a dental school interview. As an international dental student, you will be joining or starting dental school with third year dental students in the US. So universities want to test your basic clinical skills in restorative dentistry, in endodontics, prosthodontics. Certain schools like test you on certain skills when it comes to, say prosthodontics as well. This is just one of the measures that universities use. One, to just, kind of vet the students and see if this is the right candidate. They have basic understanding of what a class two preparation look like, bread and butter dentistry, I mean, as a clinical dentist in India or wherever else, right? Like these are the basic procedures that are bread and butter in our professional careers. But doing them in the right parameters of what, how it's supposed to be done is what the universities are testing you. Do you have the basic skills of what an ideal class 2 preparation when you are prepping the tooth for a crown? What are the parameters that you are following so the restoration lasts the life of the tooth? These are the skills that they test you for. And a lot of universities are starting to include a bench test preparation program or a bench test section in their interview process. So that's like something that takes place during the first day of your interview. And the second day is like an in person interview where they finally get to meet the candidate. So both these aspects are very important part of your admission process into the US dental schools.
Okay, so bench test is basically we work on mannequins or in other structures and show our clinical skill. That's what you're saying. So, are there any
Absolutely.
specific skills or knowledge required? Is it same across universities or it is different per according to the university?
Correct. Majority schools follow a pretty standard protocol. Essentially, like I said, like basic restorative procedures that they test you on a mannequin are class two, class threes on an anterior tooth, crown preparation. It could be a stainless steel crown. Especially schools on the West Coast focus a lot on like all metal restoration, gold restorations. Schools like UCLA, where I graduated from, have a very solid like lineage a program where they test candidates on, say, a gold onlay preparation. So throughout the board, majority of the curriculum that they follow or they what they test on is pretty standard, but it might vary from university to university. Only a few of them probably have an endodontic section that they test the candidates on. Same thing, they want you to do an access opening on a typodont on or sometimes on an extracted tooth, but majority of the time it is on a typodont for a molar or an anterior tooth. And very few schools on the East Coast specifically test you on prosthodontics, say, I mean, fabricating an RPD model. But throughout the board, it is pretty consistent, and they're testing you on basic restorative skills. And some schools also include a written test, which is a case based scenario. They test you certain questions that talk about, patient management. The patient comes in and they ask questions relevant to a patient's chief complaints. So some programs have that in addition to the bench test. They really want to make sure that the candidate has basic understanding of how to manage, one, have basic skills when it comes to clinical dentistry, and second, have understanding of how do you manage, a dental emergency or other clinical situations.
Yes, that makes absolutely sense. So, if I have to learn a bench test, first thing I need to know what the specific university is asking for. Because you told me, though it is more or less similar, there are certain changes based on location, type of university, and what they expect their candidates to know. So,
Right.
going to someone who knows these procedures, how it is different from in one university to the other, absolutely helps us. So randomly
Right.
thinking I can sit at home, just practice my class tools, I will be good at it, is does not
Right.
make sense because we do not know what the university is looking for. So when you're going in for a
Absolutely.
bench test, it basically makes sense that we get trained or learn from someone who knows the entire process.
Right. And honestly, just to add to that, I trained at UCLA. My first year, like after, in my third year dental school, I had started to see so many international dentists that participate in the clinical preceptorship programs. They come to the university specifically to learn the bench test programs. And I would sit with the instructors myself, the professors, and really try to understand the criteria that they're trying to gauge and test the students on. So it's nice to have that insider knowledge that I've, learned through my years at UCLA. And I was one of the instructors during the program during my fourth year. So it's full circle. So it's really exciting that I'm able to help the students out in this aspect.
Great, that's absolutely great. So now we spoke about shadowing and we spoke about bench test as well. How do they complement each other and how does one go about it?
Sure. So these, like I said, the two aspect of getting into dental school, building the basic confidence, having an understanding of how dental, practices, or how dentistry is practiced in the U.S. is the clinical shadowing aspect of it. without prior experience. Say you have been practicing in a different country, you're a specialist, you come to the US, the way that we practice dentistry is different. I mean, clinically, we're all doing the same thing, but the basics of patient management, how history taking happens, how do we build a rapport with the patient, how are electronic medical records, all of that, how is that, a part of the dental practice is what you learn in the clinical shadowing part of your, journey. Second aspect of it is bench test preparation. So once you've cleared your INDBs, and you're ready to interview for universities, that's the second aspect that's it's crucial to get trained on. And it could be like a 1 week or a few days process. Find a program where the instructors meet you where you're at, so they can guide you and train you the right way and teach you the essential skills so you are able to clear that test. And once you enter that exam room, it's not it's you know exactly what to do, and you can enter there with confidence, especially in interview rooms. So what we do in our clinical observership program is we also train the candidates in essential skills when it comes to taking or sitting for an interview, because a lot of times we just don't know what an interview is supposed to look like. We get very nervous that this is just going to be very technical, but it's important to just get that perspective as well, which you will gain hopefully during your clinical observership program as well. So that's how these two elements complement each other.
Great. So you told me about the challenges about when they enter the bench test, they do not know exactly what to do. What are the other challenges do these students face when they're going through the entire process post INBD?
Absolutely. One, which I personally feel that I felt during my time as an international dentist trying to get into an international dental school, there is a lot of misinformation. There's a lot of like, especially now that the test is pass or fail. There's a lot of scare or fear of, oh my goodness, like I practice in India, I'm a practicing dentist. What I'm doing, is it enough? Because there probably is a lack of mentorship. So this is one of the biggest challenge that I face. You do not have the right support system. I mean, and it's important to get a perspective of, dentist in the US. Finding the right kind of mentorship is really important, so you're not lost. And getting the right clinical observership, building your resume, these are some of the challenges that a lot of international dental students face. Finding the right mentorship, somebody to hold your hand while they're going through this process. So if it already comes in from somebody who's been in this system and you're able to get the mentorship from them, that's a game changer.
So you've spoken about people who have been in critical dentistry, maybe in India or some other country, and then shifting to the US. Imagine maybe I shifted to the US, I did my MPH or MHA, or in India, I tried a non-clinical field for some period of time. And there was this space where I was not in contact with clinical dentistry. Would this course help them as well?
Absolutely. Yes, this happens a lot of time, right? Just for example, it's in India where we entered dental school, say out of, right out of high school. In the US, we had like my graduating class, the dental students that I went to school with completely came from completely different backgrounds because they go through undergraduation and then they get into dental school. We had engineers, we had biochemists. So it's just a misconception that now that I've strayed away from clinical dentistry and I know I want to come back to dentistry, but my chances are just not great, which is not true. So having that kind of diverse resume always works in your advantage. So try not to get dissuaded. Like I said, we try to meet our students where they're at. So the first day that we meet with the students, if they enroll in for the bench test preparation program, is trying to gauge their clinical skills. We sit with them, we see if they have basic understanding of, like, say, restorative procedures. And then in the 5 or 6 days thereon, and the program extends on to 2 weeks even, I mean, we try to help them improve their skills. So do not worry, the skills are in the back of your head. They will come back the moment you hold that drill, even though it's been some time. You just need some practice. And finding a program that meets you where you're at and helps you improve your skill is what essentially we're trying to do.
This is a very important point. You have hit the nail exactly right. It's because a lot of people have this fear, and listening to you, I'm sure they'll be confident that if they go in, they learn it, Okay, it is not an skill which you will forget if you have learned before. And if you are not completely confident, you can train for it and you can get it right. So that's a really good advice out there. So now, once I've decided I want to get into this observership or shadowing program, what are the visa requirements to get into it? Before you listen to the answer to that question, if you're enjoying the video, do not forget to hit the like button because it shows the YouTube algorithm that you enjoy such content. And also do not forget to subscribe to the channel to plan to take your career after BDS to the next level.
Yes, absolutely. So if you have a legal or a visa, which is the visitor's visa to come to the US, it could be 1 year, 5 years, however long it is. Um, it's that's the basic requirement. Like you should be able to get into the US, through a valid visa. This is a clinical observership program. So we make it very clear to the students that there is at no point in time you will be working with the patients directly. You will be shadowing the specialist or the dentist that you work with. A lot of time there's confusion. There are students that look for dental assisting positions where they, want to get paid, say, per hour. I really want to educate the dental students that are coming into the US. Be patient. If you're coming into the US with, say, visitor's visa, you legally cannot work even as a dental assistant. You cannot get paid. But if there is a dentist that's doing that, it is definitely not legal. So try to go through the right avenues. Clinical observership is absolutely legit, legal way to be able to or see a dentist in practice, in action in the US. And they do the same, it's basically the same thing for students that go for, like, say, medical observership or clinical observership after USMLEs. So very similar, but please understand that you cannot legally get paid or you cannot seek work while you're on that visa. So this is clinically only for you to be able to shadow the dentist in a clinical setting and
It
not
makes
directly work with the patient.
really good you said that. You said it loud because I've seen a lot of people have the same misconception. They think I just can walk into US and I can work as a dental assistant. It is not your home country currently. You have to understand the difference out there. The observership program and bench test is to prepare you to get into DDS, but it is not a paid job. This is something you need to have it absolutely clear. And you cannot get a paid job with a visitor's visa. This is a common misconception, and thank you for breaking the myth.
No problem.
Okay. So my next question is, what is the advice you would give to dentists who are planning to apply to these dental universities in the US? Some important difference between those who get in and those who cannot.
Yes. Um, First of all, if you've made your mind that US is the country that you want to practice dentistry in, just stay on the path. Despite the challenges, sometimes you don't get accepted the first time. Um, from what I've seen, students that, resumes that I've read, students that got in, myself, I finished dental school. I do not even have clinical experience in India. I gone to dental school in the US right away. The only difference or the biggest advice is stay on the path, be committed, work on yourself, work on your personality. If there's find a niche in dentistry that really interests you, if you're a specialist, fantastic, you already have that. Build your clinical skills. And if you're a general dentist, say there's implant, try to get yourself within the know-how of what's happening in the world of dentistry. Be interesting person to talk to. Find the right mentors. Find people that lift you up. There will be a lot of people that'll say a lot of, negative. They will put out a lot of negative and misinformation out there to kind of dissuade you because it didn't work out for them. But if you're already on the path, if it doesn't happen the first year, it'll happen the second year. Working on yourself, working on your resume, and finding the right mentorship, finding the right clinical observership shadowing program that pull your hand and help you get through the process. Simple as that.
So it makes absolute sense because I had seen, again, this is another thing which you have been telling, which I've seen it being repeated time and again. Those who have not been successful or those who think it's next to impossible or not even given it a try would dissuade those who are going the path. So you have to put your head in, go through the efforts which are required, put in all the hard work, And just not hard work, you need smart work. For smart work, you need someone who's been there, done that, and able to guide you. These are the mistakes I did. These are the mistakes I've seen others do. Please do not do them so that you can get right there. So getting the right mentorship absolutely makes sense, makes it easier, quicker, and faster without any hassle for you. Thank you, Dr. Sidhu, for taking your time and joining us today.
Yes. Thank you. Really appreciate it. And I wish a lot of luck to all the students that are embarking on the DDS journey. It is absolutely fantastic. Having gone through that, I can tell you there's not a day that I'm not grateful that I'm able to now own my own practice. And I mean, just stay on the path. It will happen. And wishing you all a lot of luck.
Great. So all her details of how do you contact her, how do you go about the entire process, we will be putting in the description and in the first comment section below. Read it, contact her. She's absolutely helpful. She's very easy to communicate, and as she's told, she meets you where you are. So she is very good at guiding. I've seen it during our entire conversation, not just right now, even previously. Thank you, Dr. Sidhu, for being the person you are.
Thank you so much. Appreciate the kind words.
All details related to the program which Dr. Navreet Sidhu conducts are given in the description and in the first comment below. Go and check it out. If you like this video, go and check out our other videos on USA after BDS.